Thank you, Mr. Chairman. Thank you, Dr. Conway, for being here today. And certainly, you're from a rural part of Texas. I'm from a very rural state, South Carolina. So I think we both have an appreciation and affinity for the healthcare costs and challenges for people living in rural areas that are absolutely severe. The thing that I've heard from my constituents consistently as it relates to this demonstration project is fear. They're scared. Picture, if you will, I know your mother's on Medicare, as you suggested, and mine is as well, or you stated. Picture, if you will, senior citizens living in rural South Carolina, scared. They're on fixed incomes, and we now have a demonstration project that covers the entire nation. And what they see as a result of this experiment will be higher prices, less access, and perhaps in order to receive the life-saving treatment that they need desperately to stay alive, to see their grandkids one more time, is a 2 or 3 hour drive from Manning, South Carolina to Charleston. And so with great uncertainty, feeling confused and afraid, they write into our offices. And one of the more difficult things to do in Congress today is to find a way to unite Republicans and Democrats on a topic. And this demonstration project has done a very good job of creating and getting concerns from Republicans and Democrats that all sound fairly similar, save one component of the discussion. And my questions aren't that different than the questions you've heard so far. Dr. Conway, they are around rural access, they're around rare diseases, the impact on the folks who are socioeconomically challenged, and folks who are concerned that now we're seeing the government practicing medicine and determining value as opposed to the doctors and the patients working together to figure out what truly is the value proposition of their visit to the doctor. And I think, Dr. Conway, you and I both can agree at least that these concerns are at least valid concerns given the scope, the magnitude, the impact on citizens. And I believe that your desires, your intentions are good. Frankly, you're looking for a way, as you said earlier, to help Medicare be there not only for your mother who's currently receiving the benefits, but for your 4 kids. I think we share the same concern, perhaps with a different outcome. And I hope, I would even plead with you on behalf of the citizens of South Carolina who are so concerned about this project to take a second look, a step back from a nationwide implementation that could have dire effect on folks depending on their very certain paychecks or their certain benefit from Social Security. And so just to highlight a couple of areas, one question being the question in the rare disease arena, where patients in my state, sickle cell is a very powerful weapon against so many folks in my state. For patients with sickle cell and other rare diseases, blood transfusions are one of the only methods of treatment. While it is clear that blood products are excluded from phase 1 of the demonstration, it is unclear if they will be excluded during phase 2 of the demonstration. Can you clarify for my folks at home?
So you're right on blood products. They were proposed to be excluded from phase 1. In phase 2, if we were ever to propose blood products or we have put out a proposal for phase 2 that we would come forward with the specific drug classes or areas for phase 2 that we plan to address and receive comment on those areas, both public input, patient, consumer input. So our goal is to engage with Congress and with the public and specifically patients, consumers. And if we did note in the proposed rule if there were specific classes or other issues that needed to be addressed, and rare diseases was an example we named, that we would look to those public comments and consider how best to address those issues.
Mr. Chairman, do you have time for me to ask another question?
Everyone else has gotten an extra one or two, so please feel free, Senator Scott.
Well, thank you, sir. I appreciate the extra 10 minutes. Really appreciate that, sir. I didn't think that was that funny, but anyways, we'll go on anyways. I certainly have appreciated the fact that the concern from my constituents about the amount of time that they could spend on the road trying to find the right practitioner, perhaps the right hospital to go to if you're living in Manning, Sumter, or in a rural area of South Carolina. Driving to Columbia or Charleston is just not a hop, skip, and a jump. It's a more serious proposition. And I also note that Obamacare is going to provide a partnership or ride-sharing service for young folks to sign up for the health care law. How can we justify the department going out of its way to transport the young adults to sign up for Obamacare when the program you're proposing will limit access for some of our most vulnerable, like the elderly and the disabled? Have we figured out a transportation sharing program that would help with the impact of transportation in rural areas?
So for the proposal, we would want the proposal to maintain access, including in rural areas, smaller practices, et cetera. For patients and physicians who want to deliver medicines, we want them to receive the medicines when and where and how they want to receive said medicines. We put forward the proposal because we thought the proposal maintained access and improved quality and could maintain or lower expenditures, but we'll be looking closely at the public comments, including on smaller physician practice issues and rural issues, and determining whether adjustments are needed.
Once again, Mr. Chairman, I'll stop where I started. I don't doubt the sincerity or the intentions of Dr. Conway or anyone within his employ. I do want to echo my concerns for my citizens, particularly those in rural areas, those with rare diseases, sickle cell being among them, those folks who are just financially strapped. I like the socially, economically challenged. It sounds cool, but the fact of the matter is it means that you have too much month for the money that you have. And so we're talking about people who are seriously challenged and now very concerned. And as you've heard echoed throughout the hearing today, the concerns are real because while the intentions are good, the access issues are still real concerns, and frankly, the pricing, though you may have a static number, 1680, the impact on those numbers on the actual costs can be quite high. Thank you, Dr. Conway. Thank you, Mr. Chairman.
Thank you, Senator Scott.